Call on members' order of the day number 3.
SuperGold Health Check Bill, first reading.
Mr. Speaker,
The Right Honourable Winston Peters.
I move that the SuperGold Health Check Bill be now read a first time. I nominate the Health Committee to consider the bill. This, as you will realise, is a seriously non-controversial measure which should have the support of every sane, reasonable person in this House. We're proposing the SuperGold Health Check Bill as a common-sense, cost-saving policy and preventative measure. Giving 3 free GP visits with the SuperGold card every year makes more than economic sense. It will save lives and precious health dollars. Globally, according to Deloitte, life expectancy is projected to increase from an estimated 72.6 years in 2012 to 73.7 years by 2017, bringing the number of people over the age of 65 to around 560 million worldwide. That is more than 10% of the total global population, and in Western Europe, the proportion of, in 2017 will hit 20%. In Japan, it'll be 27%. And what it will be here, according to Stats New Zealand, will be 16%. But of course, that is seriously dependent upon the wisdom or lack of it in terms of immigration policy. Baring Deloitte also warned that pressure to reduce health care costs remains and is escalating due to government debt, constraints on tax revenue and ageing populations. A policy that makes medical, social and financial benefit makes common sense. Today, the price for a hospital bed per day in New Zealand is about $1,243. That's a lot of money when the average price for a stay in hospital and the cost to the taxpayer is in the vicinity of $10,000. This policy will cost about $69 million per annum based on the number of SuperGold card holders we have now. But it will be cost neutral if only 1 or 2% of the SuperGold card holders uses the 3 free visits and is kept out of having to go to a hospital. Simply put, by keeping SuperGold card holders out of hospital will help to contain health spending. Now, Grey Power has welcomed the policy, applauding it around the cost and suggesting it will be an incentive to get people to the doctor. Grey Power says there are many cases of elderly people putting off going to the doctor or declining to pick up prescriptions because of the cost. Just recently in the Sunday Star Times, it was reported that a huge premium rise is driving older people to drop private health cover just when they need it the most and pushing the burden on the taxpayer. This is because excesses are now between $2,000 and $4,000 per annum. And if you bear in mind what these people get annually, plus rates and every other cost, this is not what they can afford. Bearing this in mind, we want to keep people out of hospital. The economics of preventative medicine, simply put, makes sense. That is what this bill is about. Now, even the Conservative Cameron government in the United Kingdom has a national health service health check for people turning 65. The NHS points out that as we get older, we are more likely to develop conditions that are rare in younger people. And this is a Conservative Party-governed Britain. If they understand the need, then why wouldn't we? Economic modelling estimated saving the NHS in the UK around 57 million over 4 years, rising to 176 million over a 15-year period. I wish to table this at the end of this speech. But the lesson from the UK is that everyone benefits, and there's a real benefit for the health budget. Now, the great thing about this, of course, is that it will kick in the 2016 budget, not now. For the individual New Zealander who takes up the 3 free GP visits, the benefits will be huge in all respects: social, emotional, physical and mental well-being. A fair society is not, Mr. Speaker, a mean society. It must not be so mean that when we ignore measures that will prevent seniors from sitting at home too worried about the cost of a GP visit, we avoid the consequences that arise. As we get older, we become more susceptible to age-related issues. God knows over there, I can see many examples already. A winter cough, A winter cough can easily lead to pneumonia. Hospital beds, well, Ron is one of the fittest guys in this house. Hospital beds start to fill in winter as the elderly get hit by winter ills. So any sort of preventative care makes economic sense. For families and friends, the checks will reduce the pressure for them to act as drivers, helpers and carers when older relations and acquaintances have secondary health problems. The dissenting commentary against the SuperGold health check bill is from groups who want, and this is sinister, the dissenting comment is from groups who want more public health dollars targeted towards the older and the poorer. Groups advocating means testing for 3 free GP visits goes against the grain of the hugely successful SuperGold card in this country. Bear in mind, we're talking about people who paid some of the highest taxes at 66% in the dollar of any age group in this country's entire history. This was introduced, the SuperGold card by New Zealand First in 2007, so that all New Zealanders turning 65 are recognised for a lifetime of contributing to society. Making it universal is simpler than hiring an expensive army of bureaucrats to regulate it. And don't forget, it was all about putting old bottoms on empty seats and removing the increased carbon footprint. We're better than to place 3 free GP visits for over 65s than in the SuperGold card. Now, we recall advocating free medicine or free doctor's checks for children under 6 years of age, opposed back then, but now so supported by some enlightened members of the National Party that they want to deliver it this year, next year actually, deliver it next year to all primary school children. Now, we have always said there's much to be proud of when others adopt your ideas. Another sound reason for the government to support this bill is economics. Finance Minister Bill English is constantly telling us he has to nip and tuck and cut and everywhere to save dollars. So right here, amidst his health funding headache, is an instant remedy. The government support should be coming from Peter Dunn, because back in 2008, he promised a free annual warrant of fitness check for seniors. New Zealand First is hopeful that both National and United Future and the Maori Party, for very, very good reasons, because of affordability, will support this legislation. I know that some members here maybe have been told at caucus what they should do, but frankly, if they let it go to a select committee, we would know what the rest of the country thought. As I know, the Maori Party has always spoken out about looking after seniors. A simple scheme to keep them out of hospital must seem appealing. The Maori Party is dedicated, they say, to improving the lives of whānau, and these checks will certainly do that. A GP visit is so easy to organise for the families in this country than the comings and goings required when a relative is in hospital. It's not just the $10,000 per hospital visit. It's all the cost of relations in some cases, because hospitals are so far away from many of our provincial populations, which is in itself an enormous cost. We believe that the Labour Party and the Greens have got the picture and clearly will support this legislation, and we are grateful for that. We believe that seniors who have worked and paid taxes for decades have contributed to building the country we owe respect and dignity for, and to, should be honoured in this respect. And it won't cost us anything, it'll save us money. One sure way to make this happen is to provide the health care they need. Looking after our seniors is a lesson we can take from many countries, especially those in Asia, who elevate their senior citizens to a high status so that everyone is respected and is understanding of their needs. We commend this bill to the House. It makes economic and social and medical sense, and it's a way to put a preventative health measure in place and to do it now. Thank you very much.
The question is that the motion be agreed to. Point of order, the Right Honourable Winston Peters.
Will the NHS Health Check Implementation Review and Action Plan, July 2013, from Public Health England.
I think I'd better ask the member the question that the Speaker asked as to whether this is a document that has been downloaded from the internet.
To confess, Mr. Speaker, it was given to me by my staff and I've got no idea how they acquired it. But I do think, given how far it is away, it's very relevant.
On that basis, I'll put the question. Is there any objection to that document being tabled? There is no objection. It will be tabled. The question is...
Oh, Mr. Speaker.
Simon O'Connor. I thought we were going to have a very short debate.
It could have been. You never know. Go and get a healthy check.